question keeps coming up. How are local hospitals preparing for Ebola? And being on your side, we wanted to have with you an expert for the day to talk to us a little bit more about that. Bonnie Greene, an infection preventionist from Chesapeake Regional Medical Center, is here with us. Thanks so much for taking the time out first and foremost.
Thank you for having me.
So when we ask that question, how are the local hospitals preparing? What's the answer? What are you all doing?
We're working really hard. When we first heard that the Ebola situation in Africa, we started educating the leadership. My partner, Tiffany Silman, went to a leadership meeting just giving the basics of Ebola. And then when we had our first case in the United States, we started doing education sessions for the entire staff of the hospital. So we had 6 sessions in 2 days. We titled it Ebola 101. So everybody could come in. We gave a brief update or, what Ebola is. And then we opened the floor to them to ask us any questions that they wanted to ask us so that we could just give them the facts.
Lots of concerns once we've been hearing what's been going on in Dallas, and you see healthcare workers that have to go to other treatment facilities because of things that went or that happened there. Do you all change your plans at all given that situation?
We change our plan constantly. Just this past Sunday, I finished our first Ebola management plan, and by Sunday night, I was already changing that a little. We follow the Center for Disease Control and Prevention guidelines very closely. I monitor them daily, more than daily really, and we just update that management plan as often as we need to make sure that we're doing everything we possibly can to protect our staff and to make sure that our patients are going to get the proper treatment.
And what are some of the new things that you all are doing to protect your staff or a patient?
We have put personal protective equipment policies in place that we wouldn't typically use for the typical pathogens that you see in the hospital. So we're following those CDC guidelines and some, going a little bit above those guidelines to make sure that they're safe. So the PPE, the education, we work very closely with the local public health department who really helps us get some of the education and the supplies that we need.
What are still some of the concerns out there? I saw where one of the nurses at the Texas Presbyterian Hospital there in Dallas that treated Thomas Duncan was talking about their full garb, but it kind of showing the neck. And you really don't think like, well, could this be all that it takes?
And that is a concern that we don't want the virus to come in contact with your skin, but it's important to remember that it's a bloodborne virus, so you have to have exposure to blood or body fluids, and that has to be into a mucous membrane or through a broken skin. But we really do want everybody to be covered from head to toe to be safe. So, we're making sure we have the proper equipment to make that happen.
All right. Thank you so much, Bonnie Greene, for joining us today and taking some time to educate us about what's being done here in our area. Folks, you'll find important information about Ebola from the CDC, a live Twitter feed, and our previous coverage on wavy.com. Just look for our special coverage page under the News tab.